Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Pho, founder and editor of KevinMD. Today in the show, we have Daniel Kinderlehrer. He is an internal medicine physician and is the author of the book, Recovery from Lyme Disease, the Integrative Medicine Guide to Diagnosing and Treating Tick-Borne Illness. An excerpt from the book was published on KevinMD, and that excerpt was titled, Our Work as Physicians and Healers is to See the Whole Patient. Daniel, welcome to the show.
Thank you so much. Glad to be here.
So we'll get into your excerpt in a little bit, but first off, can you share your story and your journey to where you are today?
Here's a rundown. Basically, I did an internal medicine residency, even a chief residency, and I decided not to practice internal medicine because it's really practicing end-stage medical care. Mm-hmm. And I opened up a practice that I called nutrition and preventive medicine, what we called back then holistic medicine. I learned a lot about nutrition. I learned a lot about environmental medicine, things that we didn't get trained in really in conventional medical training. And I had a big practice in Massachusetts, your neighbor state. And then in 1996, I got sick with Lyme disease, but I got really sick and was out of commission. I was quite ill. And when I recovered, I said to myself, I want to do everything I can to help people not go through what I went through. Mm-hmm. So for the past 20 years, I've been seeing, my practice is limited to seeing people with tick-borne infections. And just last week my book came out that I've been working on for 3 or 4 years, hopefully to be able to pass on everything I've learned to both patients and to physicians.
So you have a practice primarily focused on tick-borne illness. Now, tell me some of the challenges that you see in the day-to-day cases that you see.
I would say every patient is challenging. This is not your run-of-the-mill, come in and get a culture of your throat kind of practice. When people come to see me, the first visit's usually about 3 hours, and follow-up visits are about 1 hour. And they come in with multi-system complaints that have been going on and building for years and even decades. So the problem isn't just Lyme. Then we have to figure out what else are these people infected with, because virtually all of them have co-infections, other infections they get from ticks. And they could have reactivation of dormant infections like Epstein-Barr or other viruses. Or suddenly parasites become an issue. Not only infectious problems, but these people have all these downstream issues associated with chronic inflammation. So they have lots of aches and pains, but they have adrenal dysregulation, other hormonal dysregulation, immune dysregulation for sure, a lot of neurological symptoms. That usually the neurological symptoms are overwhelming. So we see someone with a problem list between average 20 to 40 points long. Mm-hmm. And then we have to figure out, what are the different imbalances that are going on in addition to infections? And because this is a person who's been sick so long, they're pretty fragile most of the time. And we have to sort of decide, well, where can we start to intervene to help get this person into balance without throwing them off and making them worse? It's a challenge. I mean, I can say that I love the medical detective work of figuring it out, but it demands a lot of hands-on with patients. They have my email, and if they run into problems, they let me know, and it's incredibly gratifying because I see people who've been sick for years and decades, and I see them restored to health. Or I see kids who couldn't make it through high school. They were horizontal. They were so tired and out of it. And now they're graduating college. They're actually graduating medical school now. So it's an incredibly rewarding profession I'm in.
Now you talk about your vision of the doctor-patient relationship in your excerpt, and that's titled, Our Work as Physicians and Healers is to See the Whole Patient. And it's an excerpt from your newly released book, Recovery from Lyme Disease, the Integrative Medicine Guide to Diagnosing and Treating Tick-Borne Illness. Now, for those who didn't read your excerpt, can you just walk my audience through it and share the reasons why you decided to share that particular one?
Good question. I cannot tell you what the decision-making process was, but I can certainly share the excerpt with you, which is sort of armchair philosophizing at the very end of the book. And I described what happened to my wife about 3 years ago when she suddenly developed severe chest pain, sort of hunched over, and her arm wouldn't move, and, basically got her to the hospital. Bottom line was she did have a cardiac syndrome called Takotsubo's syndrome. I don't know if you've ever heard of this one. It's very interesting. There was a lot of cardiac stress, but no damage. And she had significant neurological problems. She ended up having her left leg paralyzed. Okay, cardiologists come in and say, here's what's going on with her heart. Things will be good. And she's stable. And I say, okay, so how does this relate to what happened neurologically? He said, well, I don't know. I don't deal with the nervous system. And then we asked the neurologist, okay, you're finding deficits here and there. Why is it there? And how does it relate to the fact that she had the simultaneous cardiac event? They said, well, we don't know. We don't deal with the heart. I mean, it was stunning. It was sort of the opposite of what I do, which is always to try to tie things together. Mm-hmm. Here we had the simultaneous occurrence of a cardiac and neurological event. And the cardiologists and neurologists weren't interested in talking to each other to figure out what was the underlying pathophysiology. Staggering, stunning, really, but also, as I wrote in the book and in that excerpt, it's just a very sad commentary on our Western health system, where people are shunted to one specialist, to one subspecialist, and this and that. And most of my patients had been to dozens of doctors, literally dozens, but no one has the whole picture. And if we're going to help people with chronic illness, we really need to see the whole person. And that's what that chapter's about. We need to take it all in and see everything that's happening on a physical level, as well as emotional and family constellation level, and put all those pieces together. And it takes time. And, and thankfully, my patients are heroes, really, because after spending years being ill and getting sometimes real derision from doctors, yeah, it's sad. Finally, I can give them a safe space to share all of it and try to make sense out of it. Just that is really healing for patients, to have someone be able to do that for them.
Now, ideally, that person who pulls everything together would be that patient's primary care physician. And as you know, a lot of primary care physicians, we are on strict time limits. We have to see certain number of patients per day. We have onerous regulations that we have to abide to. We have burdensome electronic medical records. And you mentioned that when you saw a patient for the first time, it took 2 to 3 hours, and a lot of primary care physicians don't have that luxury. So I guess the question is, how can you reconcile the primary care physician's job to pull everything together when a lot of them are under time constraints from our healthcare system?
I do not have a good answer for that. I mean, I could not do what you do. I could not be a primary care doctor. I couldn't work in any of these systems where, as you said, it's sort of mandated and legislated how you can practice and how many patients you have to see. It would drive me nuts. I'm just not cut out for it. And my patients are willing to pay out of pocket to see me, and some of them get some reimbursement and some of them don't. Mm-hmm. And of course, I bend over backwards to help them along those lines, but I don't have a good answer for you. I really think there are a whole lot of things we could do to decrease the big expenses we have in medical care in the United States. Just one is that something like a third of all Medicare expenses are towards the last 6 months of life. And I think if patients were properly educated on what to expect and what they would want done in any sort of heroic fashion, those expenses would go way down. There are studies that have shown that if doctors took courses on how to order tests in a cost-efficient way, the quality of care does not go down, but the cost of medical care goes way down. I know I'm going tangential now. I think the Western healthcare system obviously needs a lot of work from a lot of different directions.
Now, the patients that you see are among the most complicated. Now, are there any actionable tips that you could share with your fellow clinicians that you've learned over the years that can help us physicians see the whole patient?
I'm really, I'm working in a paradigm of people who have an infectious illness, but it's a whole lot more complicated than that. And I know how to work really well in that system. It turns out, by the way, I right now, I'm very interested in the long COVID or long hauler or post-COVID syndrome, because these patients look just like chronic Lyme patients. And in fact, I'm certain they have a lot in common. And I'm meeting with people and talking about this and maybe trying to write some articles about it. I think that those of us who've been treating chronic Lyme have a lot to offer to those people who are dealing with this long COVID syndrome. I think that it's really, really important that patients have a chance to fill out a long questionnaire that really checks out multiple symptoms. And then doctors be able to take the time to do that. I don't know how to do that for a primary care doctor who's seeing 40 patients a day. I really just don't know how to do that. I would say in terms of tick-borne infections, it's important to know that you can get it anywhere in the country. All 50 states it's been reported. And of course it's worse in New England and Northwest and the Great Lakes states, wherever there's more humidity. That's where the ticks like to go. But it's everywhere. It's everywhere. And if a patient, presents with fatigue, impaired cognition, muscle aches, joint pains, often mood problems, anxiety, depression, and irritability, think that this could be a tick-borne infection. And I'm particularly interested right now in PANS, pediatric acute onset neuropsychiatric syndrome. These are kids who develop all these mental and behavioral disturbances after a microbial infection. And certainly some tick-borne infections do that. Strep is the best known, but a lot of viruses, including Epstein-Barr virus. And these kids are in terrible shape with severe OCD and anxiety and syndromes, depression, and often very angry and oppositional and raging. And they have impaired cognition. They're falling behind in school. And they have somatic symptoms. And they're diagnosed with bipolar and this and ADHD and that. And it turns out there's an infection that's triggering an autoimmune reaction in their brain. They have autoimmune encephalitis. And these are things I wish doctors were more tuned into. I actually, when I'm describing kids, it happens in adults as well. It's just, we don't have an acronym for it yet, although I just had a paper published last week where I proposed an acronym for it. I called it MANS, Microbe-Induced Autoimmune Neuropsychiatric Syndrome. So it's not pediatric, not limited to kids, and it's not just acute onset. It's often a stuttering onset and gradually progressive onset. But there's a huge amount of neuropsychiatric issues that are associated with organic problems. And it's important not to just take someone who's complaining of anxiety and depression and say, well, you have a psychiatric problem. So I'm working with psychiatrists to educate them how to recognize underlying organic causes for their patients who have these neuropsychiatric complaints.
We're talking to Daniel Kinderlehrer. He's an internal medicine physician and he's the author of the book, Recovery from Lyme Disease, the Integrative Medicine Guide to Diagnosing and Treating Tick-Borne Illness. And he submitted an excerpt of that book to KevinMD titled, Our Work as Physicians and Healers is to See the Whole Patient. Daniel, occasionally I see these COVID long haulers or people who have long-term residual effects from tick-borne illness in the primary care setting. Now, if you were to give one actionable tip for us in primary care who see the patients that you see, what would that one tip be?
Most of these patients still have active infection. The designation of post-treatment Lyme disease syndrome, PTLDS, is a misnomer because it suggests that they no longer have Lyme disease. They do. I see these people in my office day in and day out with their chronic symptoms. They still are infected with the Lyme bacterium, but they also have co-infections with other infections that they got from tick attachments, and they have chronic inflammatory symptoms that manifest all over the body and can result particularly in endocrinopathies and a lot of neurological symptoms. Arthritis gets the most attention, but it's the neurological symptoms that cause the most disturbances and impairment.
And my final question, what's your take-home message that you want to leave with the KevinMD audience?
I guess I want a message to people who've been suffering from chronic illness that there really is hope, and don't give up. 90% of my patients get 80 to 100% better. And like I said previously, most of them have been sick for years or even decades. So don't give up. Don't assume that your doctor has all the answers. Don't be afraid to be asking questions outside of the doctor's office. Don't be afraid to read books like mine. There are other good books out. Even just recently, there's a book by my colleague Stephen Phillips called Chronic, about all the autoimmune problems associated with microbial infections. Another book by a colleague by the name of Ken Bach that just came out called The Inflamed Brain, and all of the issues that kids have that can manifest with neuropsychiatric problems. You know, keep asking questions and don't give up.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks for having me. Appreciate it.